Welcome back. And back with us today is Dr. Latashia Hicks, family physician for over 10 years who's working to optimize hormones for men and for women. Welcome back, Dr. Hicks.
Thank you. Thank you for having me back. It's a pleasure.
The pleasure is all mine. I love the way that you are working with men and women and how you're really looking at hormones as a balancing tool prior to a lot of other things that are going to help people get well and find their health.
Yes.
So I know that weight loss has been a really big topic.
It's
it
a hot
always
topic.
is, but
Yes.
right now it's a very hot topic because of the GLP-1s like Ozempic, and there are a number of other ones.
Right.
And I know that you do some of that work as well, and I'd love to hear about you have some special techniques that you use in order to help people optimize their weight
Yes.
and have less side effects with their medications.
Yes. So firstly, I'd like to say, I want you to understand that weight loss is not about weight. It's about health, okay? What we are going for is actually making you healthy. That's the goal. We want health, not just losing weight. You know, I heard someone say you can cut off your arm and you just lost some weight. So that's not what we're going for. We want you to be healthy. But there are so many things that you can take now and that you can do now that can really, really help with weight loss and help you to get there a whole lot faster by eliminating the obstacles that your body is experiencing that is a hindrance to you being able to achieve your optimal health. And so that's basically what I'm doing, is helping to remove those obstacles so that your body can do what it knows to do.
That's wonderful. So before we then talk about GLP-1s and using those, tell me a little bit about what you're thinking when you have someone come into your office and talk about weight loss.
Right. So when a person is coming in talking about weight loss, I'm going to be looking for any reasons that their body may be trying to hold on to the weight. I'm looking for whether there's a problem with their thyroid. I'm looking for whether there's a problem with their energy levels and they don't have a lot of energy to work out. I'm looking at whether their hormones are not optimized, their testosterone levels especially, because that has a lot to do with it. Testosterone is one of the biggest barriers to weight loss, and people do not even realize that their testosterone levels are in the tank. And so they're trying to work out and their body is just not responding. They're doing everything, but the body is just not responding. And so that's one of the reasons that a lot of people have issues with this. And a lot of times they also say, well, I've been taking these medications. I'm taking the GLP-1 or I'm taking this medication. It works great for me. I lost 20 pounds. But when I stop using it, it comes right back. And a lot of times people don't know the reason why that it's coming right back is because they're not addressing the root cause of what's going on underlying. And so that's where I come in. So instead of just prescribing people GLP-1s so that they can lose weight, I'm also helping to identify the underlying causes and solve those so that the person can maintain the weight loss. And that's what I desire to do.
That's wonderful. So you're looking at thyroid, you're looking at energy, you said. I'm sure you said you do some nutrient, testosterone levels. So even in women, testosterone when it's low?
Yes, even in women.
Okay.
So that's one of the things. A lot of women don't realize that their testosterone levels are so low. And this is one of the most important ones. Ladies, let me tell you. I know that. So with men, it's a much, much higher amount of testosterone. With women, ours is lower, but we still have it and we need it. And with men, it's about 10 times as much as ours. But if you don't have it, you will feel pretty miserable and a little bit tired, sluggish. You may be gaining weight. You may be having even vaginal dryness. A lot of people never talk about that. It causes pain with intercourse, which leads to difficulty with intimacy in relationships. All of these things people never talk about, but this comes along with the decline in hormones that usually comes along with age, but also can come earlier in life. So these things are very important.
Is this, how young will you do testosterone replacement for women?
Usually I try to keep it around age 30, but it all depends on the person. So like I said, everything that I do is individualized. And so if a person is experiencing a premature ovarian failure or something where they're having premature low levels, then they can also be a candidate as well. It all depends on what's going on with the person.
When somebody, just a personal curiosity with, since I work in fertility, if somebody hasn't had their babies yet, is this something you can safely do up until they try to conceive, or is this something that you need to do?
Yes. So having your testosterone levels optimized, it helps a lot with the vaginal moisture, which helps with intimacy as well. It helps with the pelvic floor and strengthening of the pelvic floor, which helps as well. With the testosterone, it's not something that you want to be doing actively when you are actively trying to conceive, because you don't want the baby to receive too much testosterone. However, because the testosterone that I work with is bioidentical, the body will use it just like it uses the regular testosterone levels. And if you have pellets in, over time, your body will just slowly dissolve those. There have been recent studies showing that that the testosterone has not caused any issues with the children.
Okay, and so when testosterone ends, maybe a year later, full fertility comes back, or in some point in time.
Oh, the fertility is there the whole time.
The whole time?
Yeah.
That's fantastic.
So the fertility for women, it does not affect the fertility. However, with men, when they're taking testosterone, it can decrease the sperm count. So if a man is actively trying to conceive, we will hold off on the testosterone optimization until after they conceive, and then we'll add in the testosterone optimization so that we won't hinder the process.
That's great. So I know we're talking about a lot of different things. We're talking about weight loss, but you do also have some supplements that help with testosterone. In that case, that can actually help with sperm count too. You do that work as well a little bit.
Yes. So we have all kinds of things that help to optimize the health. We have multivitamins and vitamins that also help to help your body to process the testosterone the appropriate way, down the appropriate pathway, so that you don't make the wrong types of byproducts that your body doesn't like. So we try to make sure to keep everything on the straight and narrow and make it go the way that your body would function optimally. So that's what we're after, really. And so we have vitamins, we have supplements, we have the actual testosterone pellets and troches and all of that. So.
Well, that's great. So back to our weight loss. I know that's what we were talking about today. So when it comes to our weight loss, you have a different method. You don't just put people on GLP-1s. You already said that you look and see, is there an underlying cause? And then you treat that underlying cause, like if it's thyroid or if you have a hormonal dysregulation or imbalance. And then you move on. What is your next step?
Right. So after that, we deal with, or even concurrently sometimes, we will deal with weight loss medications if that is what the patient desires. A lot of times, people will get the results that they're looking for just by optimizing the hormones because they never knew that it was an issue. And also, what happens is, a lot of doctors that have not gone through additional training for hormone optimization, you will go to the doctor and they will check your hormone levels and they will see it and say, your hormones are perfectly normal. There's nothing wrong with the hormones. And then, but you continue to feel bad. And you've done this and you've done that, you've tried this, you've tried that, and nothing is seeming to work. And I've had patients that come to me that said, look, I'm at my wit's end. If this doesn't work, I don't know what else I'm gonna do. And then it works and they feel amazing. So that's one of the things. I am a perfect example of that. I used to actually have trouble with my weight as well, and I'm, continue to work on my health goals. But I was about 25 pounds heavier. I was sluggish. I was feeling tired. And I found myself, after going through residency training, I gained a lot of weight. It was very stressful. And so after I gained all of this weight, I just didn't feel good. So if you look at this picture here, you'll see that on the before picture, I was actually in San Francisco, living my best life and having a great time. But San Francisco is very hilly. And so as I was going up and down these hills, I was so out of breath. I was having such a hard time. But on the second picture, after I had my hormones optimized, so the before is before I had my hormones optimized, maybe a few months after that is when I first started doing hormone optimization for myself. And then after that, my hormones are completely optimized. I've been exercising, eating right, and the weight fell off. And I actually took this picture as a bridesmaid in one of my friends' all-white wedding. And when she sent me this picture, I didn't even recognize my own waistline. So I was so excited to see my waistline and all of the work that I had been putting in. So it was exciting.
I'm so glad you brought that picture, and thank you for your own testimonial. And when we do our own work in that space, we frequently are just that, we have that much more energy towards our patients to say, this can be done. I'm sure you show that to your patients and say, look, I was that too. And so you can be exactly here too. So that's wonderful. So you do use some GLP-1s. And so tell me, how is it that you minimize some of those side effects with your GLP-1 use when you prescribe those? Yes,
so GLPs, a lot of people like them because you only have to take it once a week, and it is an injectable, but it's pretty easygoing for most people if they're tolerant to needles, right? But what happens is with the GLP-1s, they actually slow down your gastric emptying. And because they slow down your gastric emptying, that leads to food sitting in the stomach for longer than it used to, which can lead to you feeling a little bit nauseous, feeling like you're having heartburn or indigestion, and just feeling full for longer, which is what it's trying to do to keep you from eating as much. But sometimes it can be very distressing to some people. And so what I've done is I've dealt with it in a very interesting way. And what I love to do is to put my patients on digestive enzymes, because your body naturally makes digestive enzymes. It's in your saliva, it's in your stomach contents and the acid that your stomach secretes, the bile that your liver secretes, the gallbladder secretes the bile as well. All of these things, lipase from your pancreas, your body is using that to break down fats and proteins and sugars. So we can help it out to do it in a more efficient way by giving you digestive enzymes so that your body will actually break down the food. And so that way it leads to your body emptying the stomach a little bit faster and leads to you feeling better.
Thank you. And then I know we waited to the very last second to give you your little bit of information there about those digestive enzymes, and you have other tricks up your sleeve when people come see you. You can help them with that too. Thank you so much for joining me again today.
Thank you.
So will you please let everyone know how they can find you?
Yes, so if you would like to find me, you can find me on my website, www.exceptionalcareelite.com. Again, that's www.exceptionalcareelite.com. Or you can call the office 713-659-9309, and on Instagram at xcareelite, that's EXCAREELITE. And we would love to take care of you.
Thank you again for coming.
Thank you.
Come back after these messages for our next guest.